we are going to see the causes of constipation with mnemonic. So constipation can be acute or chronic. So first, let's see what are the causes of acute constipation. Now we can remember them as A, B, C, D, and here A for appendicitis. In acute appendicitis, we find constipation. Then if there is bowel obstruction, B for bowel obstruction, that can cause also constipation. C we pronounce as S, so you have to remember this with this trick. Like C, you have to pronounce as S. So S for systemic causes. There are various systemic causes which can cause constipation. Then D for dehydration. So these are the 4 causes of acute constipation. Now about chronic constipation causes, it comes from A, B, C, D, E, F, G, H, I. So many causes. So let's discuss A. So for A, the cause is anorexia nervosa. Along with anorexia nervosa, other psychiatric illnesses, you must remember, other psychiatric illnesses like depression can also cause chronic constipation. Now let's come to B. B for bowel disease. What are the bowel diseases that can cause chronic constipation? In case of chronic constipation, bowel carcinoma, you have to keep in mind. Then irritable bowel syndrome or IBS, ulcerative colitis, Crohn's disease. These are the diseases which can cause chronic constipation. Then comes C. C for CNS or central nervous system. Now under this system, again 3 things come, like peripheral nervous system, central nervous system, and musculoskeletal system. So what are the causes under peripheral nervous system? Like Hirschsprung disease, then autonomic neuropathy. Under central nervous system comes cerebrovascular accidents, then Parkinson's disease, and multiple sclerosis. Under muscular system comes dermatomyositis, systemic sclerosis. So these are the causes of chronic constipation under the central nervous system. Now comes D. D for mainly drugs. What are the drugs that can cause constipation, like chronic constipation? One is codeine, then anticholinergics, then antidepressants. These are the drugs which can cause chronic constipation. You have to ask the history to the patient if they are using any of these drugs. Then next comes E. From E, mainly endocrine causes. What are the endocrine causes? Like diabetes mellitus, then hypothyroidism, then hypercalcemia. So these are the conditions which you should keep in mind. You should ask the history of diabetes, you should look for hypothyroidism and hypercalcemia. Then comes F. From F, faulty habits. Faulty habits of the patient. Like some patients use laxatives, rather abuse them. Laxative abuse can cause chronic constipation. Then comes G. From G, geriatric population or old people. Chronic constipation is a very common finding in old individuals. Then comes H. H for hemorrhoids or piles. Associated with hemorrhoids, any other anorectal disorder can cause chronic constipation. Next comes I. From I, it is insufficient dietary fiber intake. So if a patient takes very less fiber in his diet and usually is older age group, so he may present with this chronic constipation. So these are the causes of chronic constipation with the mnemonic from A to I. Now when a patient comes with a history of chronic constipation to you, you must identify the most dangerous conditions first, and you should first exclude them with investigations and clinical examination with proper history taking. Like you should keep in mind, you should not miss a bowel carcinoma. You should ask for any symptoms of hemorrhoids or any other anorectal disorders. You should look for history of diabetes, hypothyroidism. Thank you for watching.